Hey there, I'm Mike.
And I'm Matt.
And I'm Jody. The Wild Health Podcast is our quest into human performance, longevity, and personalized medicine. Together, along with experts in these fields, we'll learn how to live longer, better, and become smarter and stronger. We'll do the deep dive into the research and hard work of putting it all together, and you reap the benefits.
I've got a question for you. You recently were in Bend, and we went to a gym and did a pretty hard workout, like some heavy deadlifts and squats, and then we did some sled pushes. And this particular gym happened to have a hot plunge and a cold plunge pool. I jumped in there after our workout. I don't know, I went back and forth like once every minute or something like that. And I feel like maybe I recovered a little faster than from that workout than I would have expected. And I'm wondering if that's because of the hot and cold plunge. I mean, I know there's supposed to be some sort of benefit here in terms of at least exercise and recovery, but I know that you also use cryotherapy a lot more and really kind of dabble into this a little bit more than I do. So I'm curious, are you using cryotherapy on a regular basis? And if so, why?
Yeah, I do quite a bit. I really like it. My first experience with this ever was in Sweden, in Stockholm, at Yasuragi Japanese Spa. We were teaching a course there, and they had these saunas outside, and it was February. It was snowing. They had this cold plunge. And I remember getting in the sauna, going out, dipping my entire body in this cold plunge, coming up, and it was just amazing. Like, my brain felt on fire. I mean, it was just a really cool feeling and cool sensation. I really liked it.
Does it make getting in the cold water suck any less, being in the hot water first?
Well, it was in a hot sauna at
Okay.
the time, yeah.
Yeah.
So I just really liked it. I didn't know any of the science behind it then, but I liked it. So since then, I've always wanted to try kind of the whole body cryotherapy, the nitrogen tanks, and I've been doing that in Lexington. So I found a place that has it. I started doing it, and then actually got my own machine.
What is that like? Like, what you're getting in a tank? I mean, obviously, like the liquid nitrogen is not touching your skin. Otherwise, it would freeze your skin off. I mean, what is that tank like?
Well, it is. It's coming in. I mean, actually, not the actual liquid, but it's coming out in gaseous form, and so it's completely dry. So it's I think it's like negative 180 degrees. So it's really cold.
Yeah.
But it doesn't feel that cold. So it's not like water. So when you get in water that's 40 to 50 degrees, that feels more uncomfortable
than
that negative 180 degrees, just because
the coefficient of like convection or whatever is different for water versus gas.
So it cools your skin down really quickly.
So it's like walking outside when it's like frigid cold outside. No.
You've never walked outside when it's a negative 180 degrees. So it's definitely
man,
more
it's pretty
painful
cold
than that. I will tell you, though, I mean, I've done sauna sessions. I worked out in a sauna and then got right in cryotherapy, and I'm still sweating. Now, that's cold. So if you're wet, you're not supposed to be wet, but if you happen to be wet still, that's really cold. But it's only 3 minutes, and you're not going to hurt yourself in 3 minutes. I mean, you have certain extremities and digits that technically you want to keep covered during that.
Right, so you're not naked in this thing. You're wearing some undies and some like gloves and
I wear undies.
Sandals
they give you gloves and they give you sandals. I generally just, when I'm in this tank and they don't see me, I take those off because I feel like my hands, you lose so much heat through your hands. I feel like, why am I covering my hands if I really want the effect from this? So I take my gloves off. Don't tell anybody. But actually now I have my own cryotherapy tank, the spa that we've created at the castle. So we have one. I got one. That's how much I like it.
You've got a liquid nitrogen cryotherapy tank?
We do. Yeah, we do.
At the castle?
We do.
Whoa.
So before we got that, though, I would still do cryotherapy, but just with the pool when it got really cold. So
and I've done that. I mean, and it feels, I agree with you, it feels refreshing in the sense that, you're in somewhere hot, you jump in something cold, it's very like shocking to the system, and you do get sort of this mental clarity out of it. But what else? I mean, is there any more benefit? I mean, it's going to save your life, right?
So I think maybe you're asking, like, what's the science behind it? So if you just go online and Google cryotherapy, you're going to read about all these incredible benefits of it. It's going to improve your immune system. It's going to make you lose weight. But there's not a whole lot of science for that. Now, when it comes to things like rheumatoid arthritis, there is some science. So when I tried to look these things up, found a systematic review for cryotherapy in inflammatory rheumatic diseases. And they did find, when they reviewed the literature on this, that there was actual benefit. And they talked about the mechanisms for that. So it talked about it decreasing inflammation, leading to downregulation of things like different specific cytokines, cartilage-degrading enzymes, some proangiogenic factors. And so those mechanisms are probably the same thing for a lot of the other benefits that you'll see when people are talking about it online. So it makes sense it's going to be good for you, but there's not a whole lot of science for the other things that people talk about. Now, the weight loss, that's a big one, because anytime you can tell people they can lose weight by doing something, they get all excited about it. So I see that a lot, but there's not good data for that, really.
I don't even understand the mechanism for that.
Well,
is that
no,
just
there
like
is.
a theoretic increase in metabolism?
Yeah, you're
basically?
shivering, right? I mean, you get in
for like
you're
3
shivering.
minutes.
Right. But theoretically, it could kind of ramp up your metabolism, and I mean, you're activating your body in general.
Yeah, I haven't seen any
increasing
data to
blood
suggest
flow.
that lasts, though, right? I mean,
No.
that would also suggest that people who live in northern states have like a higher metabolism than people that live in southern states, which I don't think has been shown
I guess
to be
if
true.
they walk around naked outside, but yeah, but either way,
If it
anyway,
was
I
negative
mean,
180.
I agree with you. Like, I don't think that's one of the benefits. It could be, but there's no real science for that, so I would never say that to somebody. But recovery, so decreasing inflammation, honestly, that's the main reason that I do it.
And that's the one I could buy into. That one makes sense, right? I mean, because we've been icing extremities after injuries for years for this very reason, right? Anti-inflammation. So in sort of like a whole body aspect, it kind of makes a little bit of sense.
However, so I actually usually don't do this right after exercise, especially intense exercise, because think about what it does, the mechanism.
Yeah, it's
so it
interesting,
shuts down the inflammation. The reason you get a positive response from a stressor like a workout is the acute inflammatory response, the hormetic effect of that inflammation. And there actually are some studies showing that you can blunt that and get a little bit of a decrease of effect from the workout, similar to we've talked about. I think we've talked about vitamin C before, and now it can have a similar effect, and that's why I don't use that or a lot of other antioxidants.
Have you thought about delaying the cryotherapy after the activity to some degree?
I totally have.
Yeah,
I've done that.
like you do something hard, like say you do heavy squats,
Yep.
right, and then you wait like 3 hours.
I
So
looked
that you
into this
get that,
timing.
so you
Yep.
get that entire like inflammation response, and then you do the cryotherapy to help reduce the DOMS the next day. DOMS, delayed onset muscle soreness.
Yeah, so two things. So first off, there actually are some studies on when that peak inflammatory response is, and it's about an hour afterwards. So I try not to do any cryotherapy or anything like for an hour afterwards. Maybe 2 or 3 hours, like you mentioned. Maybe that would be beneficial. I'm not sure you would get the same. So the deal about the DOMS and decreasing that, I think those two I don't think you can have it both ways, honestly. I mean, maybe you can. To me, I do cryotherapy 3 hours later because I like it and it feels good and I enjoy it, but I don't do it for the DOMS. I had to kind of look at this one of two ways. If I want to get maximal effect from the workout, I'm going to do sauna. I'm going to do the opposite. I'm going to create more inflammation. We've talked about how sauna is going to improve endurance and strength if you do it right after a workout. I'm not going to do the cryotherapy. But I'm also going to be more sore and have more of that DOMS that you mentioned the next day. So if I need to go hard the next day, if I had like a game, if I'm still competing and I've got a game the next day, then I probably will ice because I'm more concerned about the performance the next day than I am the overall response to that particular stressor.
Yeah, I think the application of cryotherapy and any anti-inflammatory post-exercise activity probably changes significantly between the athlete and the weekend warrior, which I would sort of consider ourselves, right? I mean,
yeah, we're not making any money with our workouts.
I don't know.
And I don't think anybody's impressed with our workouts anytime soon. But yeah,
I haven't heard that in a while now.
But if you understand the mechanisms, then I think you can apply heat, cold, things like that to your workouts to get a little benefit.
This is cool. Sounds like another way, and has a lot of corollaries with the sauna too, right? I mean, it's a way to make yourself uncomfortable,
yeah,
which is probably a good thing, right?
Yep.
I mean,
there's a great book actually. I don't know if you read the book. What's it called? What Doesn't Kill Us.
Yeah.
What doesn't kill us. It's like how freezing water. Let me pull it up. Good. So how freezing water, extreme altitude, and environmental conditioning will renew our lost evolutionary strength. So it's Scott Carney. I really like that book. I thought it made so many great points, and it applies to so many things we've talked about, like fasting. Our bodies are designed to occasionally fast. We need that. The cold, the heat, those acute stressors make us stronger. I tell people frequently that I believe you need to be really uncomfortable at least 2 to 3 times a day. And I don't even just mean physically. I just mean out of your comfort zone. So talking in front of people, getting cold,
pushing
getting hot, being
yourself
hungry,
mentally, getting in a
hard
sauna,
workout.
exercise,
Yep.
going to bed before you're tired. Like all of these things that we talk about. Actually, so many of the things that we talk about on this podcast are really just about making yourself be uncomfortable in different ways.
It's really easy in the world we live in to be soft, to sit on a couch all day, to ride in a car wherever we are, to eat every 3 hours because there's food everywhere. And I think it's important that we kind of push ourselves to live a little bit more of, well, I guess what would it be? Would you call it like an ancient lifestyle? Or I mean, the paleo. People talk about paleo all the time. Yeah, wild. Yeah, good point. Probably should have used the wild word. Yeah, so that's another reason I like it. But I think it's got other benefits other than just being uncomfortable. And if you don't want to be uncomfortable and get the benefits, I'll tell you, the cryotherapy machine is less uncomfortable than jumping in water. But it's not necessary. I mean, at home, I don't have a cryotherapy machine in my home, and so I do have a sauna.
Even though it's negative 180 degrees, you feel like it's less uncomfortable than jumping in a 50-degree pool?
Yeah, totally.
Really?
I mean, especially for, well, I mean, so
I just assumed it was terrible because it's a negative 180 freaking degrees.
So if you were to stay in the water for 3 minutes, no, that's more painful. It just
Okay.
is. But I'm not in the water that long, I think. And maybe I should be. I feel so painful.
I make it about a minute and a half in 50-degree water before I'm like, all right, time to roll.
Yeah, exactly.
Yeah.
But you don't need a cryotherapy machine, really. I mean, so at home in my house, I usually do a cold shower after the sauna session, and I just really like how that makes me feel too.
I take a normal shower, and then at the end, I just turn it all the way down to the cold and just at least get a minute or so of cold water.
Yeah, I mean that's what I mean. Like,
It's refreshing.
I'm going to shower after a sauna. I'm going to do the whole thing cold, but I'll try.
I think we mentioned that during the sleep podcast as well, right? I mean, how the cold and getting your body temperature down before sleep is beneficial as well.
Yes, in theory. Like I said, I tried to look up the science on that, and I couldn't really find the science. It makes sense, but in theory, it does. And if anybody's interested more in this, I think just about everybody's heard of Wim Hof. I first heard about him when I read that book, and he does some really incredible stuff around cold in general too. So, I mean, I don't know how much of his
Science backed.
Yeah, but that's the thing. Like, experience is important too. I mean, I have a
Agreed.
great experience around this. I mean, you can't argue with some of the things that he does, and they have done some studies on his immune system that are really cool. Like,
Even if there's not any science to it, if it just makes you a harder person, that's probably in a lot of ways better, right? I mean, if you can tolerate more, then that's going to make you better in so many different ways.
If there's one dude under 180 pounds I would not want to fight, it's Wim Hof. Yeah, that guy.
Especially in the snow.
Yeah, in the snow. I mean, he's pretty crazy. I heard him talking one time about trying to swim underwater between two holes he cut in the ice, and then his cornea's frozen. I
think that was on like a documentary or something. That was amazing. Yeah.
Yeah. So maybe don't go all like straight Wim Hof, but if you want some inspiration to do cryotherapy,
Don't get all Wim Hof on me. All right, let me ask you another question, Matt. So on the regular, you seem to send me these texts with a temperature. It's just a picture of a thermometer, and the temperature is often like 101 degrees.
Yes.
Talk to me about that.
Well, I'm not happy just doing sauna and cryotherapy. I like to measure things, and I like to experiment. Like, I want to know exactly how I get my core body temperature, the highest and the lowest. And so
like under your tongue's not good enough?
No, we're not going to talk about how I take my temperature, okay? But you can, if you measure your core body temperature continuously, then you can see how these different things will affect your core temperature.
So have you done this in cryo before?
No, and the point with cryo is not to get your core down super low. A lot of it has to do with getting the skin really low, and that the signals that sends to the rest of your body.
And a lot of this stuff that we talk about, like benefits of the sauna, we think are probably related to heat shock proteins and vascular changes in diameter, constriction, relaxation. I wonder if there are some corollaries there with cryotherapy to some degree, because you're getting the same or sort of the reverse vascular response, right?
That's exactly what a lot of people talk about. I mean, this is kind of another like workout for your microvascular system in general and cardiac. And I shouldn't have said that your core body temperature doesn't really go down. I have not tested that on myself, and now I am. Like, now it's actually driving me crazy that I haven't
done it. Yeah, I can't believe you haven't done it.
I will do that, and I will find out after like several minutes of freezing cold water.
Would be interesting to see how long it takes you to drop. So I know you can get your core temperature up to what, like 101 or something, working out in a sauna?
I've been 102.2 before, yeah.
Man, that's
impressive.
Kettlebell
swings.
You've got the flu doing kettlebell swings inside a sauna. So I wonder how quickly you could get it low. Yeah,
so I'm going to try that. I mean, my assumption when I've done cryotherapy before, right right afterwards, I feel fine. I do not feel like my core temperature dropped. I mean, you're shivering. I think our bodies do a pretty good job of keeping us warm. And so I always just kind of assumed I mean, we see patients all the time that have fevers, and we also see some hypothermic patients. It's much easier to get someone's temperature up than down. The body just it heats up pretty efficiently when it's cold. So I 2 minutes, 1 minute after a cryotherapy session with liquid nitrogen,
You're
I
probably
feel
back to normal.
completely normal.
Yeah.
Honestly, I feel sometimes a little hot, like in my body heated back up. So now that's different in the water. In the water, I feel cold longer. So my homework is I'm going to try both, and I'm going to measure my core temperature, and I'm going to get back to you on that because now I'm pretty curious.
All right. So outside of your core temperature, you mentioned earlier that you feel mentally more refreshed or something like that. Any idea why that is?
I think so. I think so. What I've read is you get a release, and I didn't read this in a study, so I hate to even say it, but what I've read is you get a release of endorphins and serotonin when you do this, and it makes sense. Honestly, I don't really care because I feel good. I know it feels good, and I'm going to keep doing it. I don't think it's a harmful thing, but I think I'm pretty sure it's an endorphin and serotonin release. Anytime you stress the body frequently, that'll happen. I mean, just like when you go for a long run. So
the endorphins make sense for sure. I don't know about the serotonin. I can't really place that in my mind. But, I mean, endorphins that's almost seems obvious. But I guess that makes sense as to why you would feel mentally a little bit fresher. It's like drinking a cup of coffee. So is there anybody that shouldn't be jumping in a cryotherapy chamber? I mean, are we recommending something to someone out there that could actually hurt themselves doing this?
I mean, I guess the way I think about this is it's a stressor. So all the things that could potentially be good for you but are stressors, it's kind of the same group of people that probably shouldn't do it just because it could have negative effects. People who are pregnant, in general, like really high blood pressure, somebody who's at very high risk for having a heart attack, like a recent heart attack or unstable angina, people with cardiac arrhythmias. I mean, you've seen cold patients, Mike, right in the ER going to VFib.
Absolutely.
So I'm not saying it's going to put you in VFib, but if you're predisposed to an arrhythmia, then this could be a kind of a shock to the system and throw you in there.
Yeah, I think anybody with any cardiovascular risk is probably somebody who should be a little bit careful about this,
yeah,
right?
I would say be careful. I mean, obviously you want to improve, and if this helps, but yeah, if you're high risk, no. And I mean, obvious things like Raynaud's. If you got Raynaud's and you have pain when you go outside.
And probably the answer is more start slow rather than avoid altogether, right? I mean, it's probably just something, you don't want to jump into this and like, you've never been in cold water before and then you just like plunge immediately in a pool from a hot sauna. Like that's a pretty big shock to the system. You might want to sort of ease into this kind of thing.
Well, no, you literally want to plunge right in.
No, but I mean, maybe you don't start at 33-degree water. You know what I'm saying? Like,
no, start with a lukewarm shower. You're in the shower, turn the temperature down until you can't stand it anymore, and then breathe through that, like 10 deep breaths. This is how I started the first few times I did it. Just really, I mean, other than the Yasiragi, and that was just a really cool experience. But if I'm doing it at home, and then I'm just turning the water down to as cold as you can, and then seeing how long you can tolerate it. And cryotherapy is just not that painful. So if there's a tank around you, I would say go try that, because the cool thing about that is they ask you if you want level 1, 2, or 3. And if you get too cold, you can get out. So I felt like I was wasting my money if I didn't say 3. So I've never done anything other than 3, but you can totally do 1 or 2. And I tell you, and actually, if you're in the Lexington area, come to the castle, use the code word or secret word, Wild Health, and you get your first cryotherapy treatment free. I just made that up, so I need to tell somebody at the
You should probably tell somebody about that.
to actually honor that. But tell them Matt said to say Wild Health.
That's so true for so many things that we talk about on the podcast, actually, is that easing into these things is probably the best way to get started. Like, for example, fasting. I mean, I think you probably start off with maybe this like 16-8 sort of protocol. Maybe you try like the 24. And then, once you get a little bit more comfortable with it, maybe you try the FMD. And then after a fasting mimicking diet, then maybe you try the 2-day or 3-day water fast. I mean, just like with fasting, you can do the same thing with cryotherapy or with a sauna, just slowly ease into these things. And I think it makes them a lot more tolerable. So to summarize, it sounds like there's not a lot of data behind cryotherapy, but there's a lot of common sense behind cryotherapy and a lot of sort of subjective opinion that people feel better on it. You feel more refreshed. You feel like there's less inflammation. Maybe you recover faster. Maybe some weak data on treatment of rheumatic disease. But beyond that, it sounds like it just sort of makes you feel better.
It's worth trying. It's not, I mean, we've talked about a lot of things on the podcast that we really feel strongly about with a lot of medical evidence. And I would focus on those if you're trying to optimize your health. But once you've got those down, this is a really cool modality, I think. And what I like about it is it's so quick. Like we're talking about 18-hour fasting windows and things that are kind of difficult. This is quick. This is easy. Try it out. If you like it, great. If you don't do it anymore. It's not that big of a deal, but I really enjoy it. And I bet you enjoyed it, and if you don't, not a big deal.
We hope you like listening to the podcast as much as we like making it. If you think it's valuable, share it with somebody. Send it to someone you think would really benefit and leave us a 5-star review in iTunes. Those reviews really, really help us out. Find us on Facebook and follow us on Instagram at WildHealthMD. If you didn't like, well, why are you still listening? Email us and let us know what we can do better. But the best way you can thank us for our time is to leave a review and share. Until next time.